Hi.
Hello, may I please speak to Andrew Ditch?
Yes.
Hello, Andrew. My name is Paula Lessick. I'm the psychiatrist nurse practitioner working with Steve Sweeney.
Okay.
Okay, calling today for our appointment.
Yes.
I'm running a little late. Is this a good time for you to talk?
Yes.
Okay.
Before we start, I want help. Can you help me with a group home, even if it isn't through the Office of Mental Health, but with the Office of People with Developmental Disabilities? I want help. I've been waiting for a group home that have been promised to me for 19 years. I've been promised therapy be only to be denied and then not help me.
Okay, Andrew.
Yes.
So that conversation, I would need to defer to your counselor. I apologize. I don't know anything about that aspect of treatment. So today's purpose would be to discuss your history and your symptoms and see if there's something that we can do for you in way of medication. Does that sound okay?
Okay. Can I ask you something for anxiety and something to help me pay attention better? The only two medicines that helped me in the past for my sensory problem and anxiety were Abilify. I can't go on that because of the GI bleed issue and A1C. And even though I went, Dr. Woolen had prescribed that to me, I went behind his back to continue that, even though he took me off of it, from my last primary doctor at Dr. Jane.
Okay, so first I'm going to have to do a whole assessment with you. It's going to take about an hour, and then we'll talk about that. Okay, so let's start with how you're feeling right now.
A lot better than what Andy was with my family.
A lot better than what?
A lot better than what I was with my family. Even though I have no routine, nothing to do, it's just, I feel a lot better. A lot less worried, a lot less, scared. And, that stuff. I'm just really scared of meltdowns. They scare me so much that Andy don't want to have them anymore because they hurt me.
Okay. So if I understand this correctly, are you living in a hotel right now?
Yeah, with no services, no medications, almost no food. Not even able to take my own medicines if Annie's prescribed them.
Right. Okay, so you need to ask. Okay, so you're feeling better, and now that you're living in a hotel.
Yes.
And where were you living before that?
On the streets, and in hospitals. I can't take much more change.
Okay.
I just want to be normal.
Okay.
I don't want an autism thing. I just want to be normal.
Okay. So, tell me, Andrew, when your symptoms with moods started, how old were you? Tell me about that.
What do you mean moods?
Okay. Concerns about how you feel. Okay, when did that start? Mentally, when did your mental concerns start?
I'm not understanding what you're asking.
Okay, how old were you when you first started having problems with your mood?
All my life. If you want to ask me, if you want to ask me what my actual being sad is very rare for me, if that makes sense. My normal moods are scared and reacting to what is around me.
Okay, so you've had problems with difficulties feeling scared?
That's my most common feeling.
Okay.
Of like way my family treats me and stuff like that, and not getting the services. And is Andy going to be able to get food, or am I going to get help, or that kind of stuff? Or is somebody going to make a loud noise, or is there going to be a thunderstorm, or is there going to be a change, or is that stuff? I just want you to know, Andy don't have I mean, I understand that there's a certified past diagnosis of bipolar disorder. I do have a DSM-5. I'm very smart, if you can tell. I question that diagnosis myself, but
Okay.
I don't understand why. I mean, if you want to,
Andrew, yeah, wait, okay, let's go back
Okay.
to your experiences,
Okay.
okay? So what you're telling me is that you were feeling scared all your life, and
well, not all my life.
Okay.
My home feeling when without a trigger being there is calm, happy, and just pleasant. If that makes sense.
Yeah.
When there's
okay.
a trigger involved, I do get scared, and then afterwards, I may get sad for like an hour, but then once there's something there to distract me from being scared or sad, it's over. It's all all emotionally triggered by what is going on around me. If that makes sense.
Yes, okay. So I want to hear more about that. Tell me about the worrying, okay? Tell me about that.
I'm scared right now. Not right now at this moment because I'm actually understanding have all new providers. I had to give them time and patience to help me, but Andy's already in a vulnerable position and want away from my family. I'm worried about when my next meal is going to be, when Andy's going to be able to get help, when I'm going to get into group home. Who's going to be there to help me? Will my needs be met? Will there be all these other changes going on? Will there be sensory problems that could affect me? That stuff.
Okay.
And here, at the end of the day, somebody who wants help has been denied the services to become independent so I can help other people like what you do.
Okay.
I mean, everybody has asked me, how do you not get sad? Or even, I mean, I don't even want to even think about this as Andy understands a lot about mental health from being in school, in health class and psychology. You know as well as I know, when you're traumatized like Andy's been throughout my life and wanting help and the issues going on with my family and everything, people like me usually end up committing suicide. And let's hope that never even becomes a feeling for me. Because I never feel that way, if that makes sense. And that's why I'm asked by a lot of people, how does that even not even happen to you or feel like that to you? Well, I don't know why. Just maybe because I'm unable to understand if it is abuse or not. Maybe it's not normal when I'm treated. If that makes sense. And Andy also does not feel that way, and I'm blessed to feel that way. A lot of my language problem of understanding if my dad's abusing me or not, I don't know if it is or not. I don't know if it's intentionally or being mean. It's just not normal. You don't see anybody else being treated that way. And I just want help.
Okay, so how do you feel you're being abused?
Verbally. You asked me how I'm being abused?
Uh-huh.
Okay, just want to verify. Verbally, emotionally, and, with my actual needs. And then I'm being blamed constantly, put down constantly, accused, assumed that Andy's the only person that counts, assumed that I'm the only person that matters. I have no feelings for others. So not true. May not have the language to express my feelings of other people, but Andy does feel people. I love people. I don't need to be treated like my dad does and then hurt my ears.
Okay, so tell me, give me some examples of how you've been verbally abused.
I don't have any words to put other than it's on YouTube.
Okay, well, I'm not going to watch YouTube, so why don't you just tell me?
I can try to put it in words with what I've been listening to, and it's traumatizing just to go through it. My dad knows loud noises hurts my ears. What does he do? He does the same. He does it day in, day out. What does he do? Another thing, he uses that as his hearing problem. Well, 1 minute he can hear my phone conversation when it's not on speakerphone up to my ear. The very next minute, he's yelling in my ear, talking to the person that's on my phone, and he's not even anywhere close to being able to hear. And then he uses his hearing problem. And then he verbally abuses me by putting me down, like, get a job, which is more than my ability to get a job right now. But Andy wants to have a support first and been told, to get into a group home before getting a job. So that's what I'm going through.
Okay.
And
so you have a sensory impairment, and you feel like your father talks very loudly.
And he degrades me, like, get a job, get a car, get a license. Well, Andy got a learner's permit just to please my dad. It's not safe for me driving. Too many distractions, all the spinning wheels, all the lines going by, the numbers, street signs, everything. It distracts me. Andy wants to be independent. I don't want to rely on people. I'm smart. I deserve help. And then to be put down like, you're over 18, autism for babies. Constantly degrading me like that. Do it yourself. And no routine. No help with anything. And then he expects me to put my own self and safety by cooking. Or not knowing how to cook properly. Very smart. Very potentially very good at cooking, but Andy needs help. I need help learning how to shower properly. I need help learning how to care for my needs properly. I'm smart.
Okay.
I'm glad I'm on a weighted blanket because Andy would not be able to talk to like I'm trying to get help.
Okay.
And I'm more relaxed today underneath my weighted blanket, and my room is dark, so I love it by myself. But Andy needs to be around people, too. I don't want to help people. I love people.
Mm-hmm.
Which I'm told is not an autistic trait, but who cares? I love people.
Mm-hmm.
The book that my mom, and I don't understand if it had any influence in me or not, The Little Engine That Could. My mom had to read that day in, day out, for whatever reason, was my favorite book.
Mm-hmm.
And could that have had any impact on me for positive thinking?
Okay.
Because I love that book, and actually I recently bought it on Google Play, just so I can have it, because I love that book. I don't know why. It's a children's book, too. I have trouble reading, though.
Okay.
Anything else you want to know? I mean, it all depends on my behaviors and emotions are triggered around my environment. Like, if something's loud, Andy's loud. If I'm, upset, other people are upset, and then I'm triggered off of their emotions and things. And I'm not aware of it.
Mm-hmm.
Just repeating to you what people have told me.
Okay. All right.
And I understand that may be a developmental disability been told, by the way, the mood regulation problem. Not so much a bipolar or mental illness. Could that be true?
Yeah, could be. All right.
Well, either way, you do know I'm still struggling.
Yeah, I do. So let me go through then. How you're doing right now. Are you having any fever, chills, chest pain, shortness of breath, gastrointestinal symptoms, pain with urination, musculoskeletal pains?
Can you go one at a time with me?
Yes, I can. Fever or chills?
No.
Okay. You have a rash?
Yes.
Tell me about that.
It's more of a sweat gland infection, and it's caused by my pee and poo problem.
Okay. And what is your pee and poo problem?
What is your pee and poo problem?
Yeah, that's how you describe it. So that's what you named it. What is that?
What is that? Pee and poo problem you're talking about?
Yes.
Sorry for repeating you. My dad yells at me for that. Sorry.
Oh, that's okay.
Sorry. I can't feel the need to go pee or poo. The only time I know how to go poo is when I fart or have stomach pain. Then you go sit on the toilet. But there is a little routine that I've been trying to do, and you know what? Without my first on board, and it can't even function. I forgot to take my morning time routine of taking a shower, and or actually bubble bath is easier for me. And before every each meal, I sit down on the toilet for 5 minutes. Or before my bedtime shower.
Okay. So Andy, do you have bowel accidents?
Yes.
Okay.
And if there's not a bath or a shower available, I do need help making sure I'm clean.
Okay. So you don't feel the urge to defecate?
Or pee.
Okay.
Just like hunger or full.
Okay. So what is that about? I mean, what's causing that?
I don't know. Been told by a few doctors it's autism. Been told it's sensory unawareness by my urologist. Been told there may be a link between my surgery when younger for the unattended testicle surgery, the two of them.
Okay. So you don't feel the urge to urinate either. So then what happens? Do you have urinary accidents?
Yeah.
Okay.
I do make the toilet for poo a lot, but there's also a lot of time I don't make it.
Okay. And you never feel the urge to urinate, is that correct?
No.
Okay. And urology told you it may be a sensory impairment?
Yes.
Okay.
And that's with the hunger and full feeling, not feeling that.
Okay. All right. And you also had
that's part of my reason why Abilify was such a hard medicine for me, because Andy had to eat all day long, and it didn't matter how full I got. I used to throw up just because of overeating. Did that make sense? And that medicine made me eat a lot.
Right.
And I wasn't even hungry.
Okay.
And never knew that was a side effect, like the trouble sleeping.
Okay.
And that put a fence between me and my environment for me being a response to my environment. It also hindered my language in written and verbal.
Okay. So Andy, have you been to a gastrointestinal specialist?
Would that be Dr. Fitzgerald?
Doctor for your stomach and intestines.
Yeah, I believe, Dr. Fitzgerald.
Okay. And Dr. Pizzarelli?
Fitzgerald. He's at Buffalo Med Group. He's my GI doctor.
Okay. And what did he tell you about that?
Well, he's not treating that. He's treating my GI bleed that stopped and not being able to take my metformin properly.
Okay.
Believe it or not, that was the only medication at the time that was still continued that with the GI bleed.
Okay.
That it had actually stopped since.
Okay. So when did you have a GI bleed?
Forever, but it hasn't come back since being off the metformin in end of January. But my primary doctor still wants me on it. But before that I was hospitalized in I want to say April 2018.
Okay, so you had a GI bleed in April 2018?
That's when Andy was hospitalized when I was throwing up blood. I was very scared knowing that black was a sign of GI bleed. But what ended up me getting help and Forrest getting help was throwing up blood. I never knew coffee grounds was throwing up blood.
Sure.
I had a tube down my nose. That hurt like hell.
Yeah.
And they kept me in there for 5 days or 7 days rather. But I can mercy days. But I was on level 1 trauma unit, which my mom at the time was suffering from a stroke and aneurysms. So she was in Macaulay's right behind me. And it's very sad that my mom actually remembered as being a nurse, level 1 trauma, meaning the ER doctor could not leave my care.
Okay.
I had a dedicated OR from my dad telling me when I was so out of it that they had a dedicated OR room and staff around the clock for the first 40 hours of me being there. Had a heart cart outside my room. Thank God that never was used for me. And oh my God, that was so loud when they used it on a room next to me. And yeah, Andy really struggled with. I really got sick. I couldn't. My dad said I was more grayer looking than my grandpa was before he died.
Wow.
And that's sad.
Right.
And apparently, I almost died.
So Andy, who is your primary care doctor?
Dr. Fasinello.
Can you spell that?
Can you spell that? Who, Dr.
Yeah.
Fasinello?
Can you spell that? Yeah.
Yeah, it's like Dr. Jello. But I had to unlock my phone. Hang on. That's how I learned how to say it. It's like I put Jello and together with Dr. Fasinello. It's Fasanello.
Okay, and when's the last time you were there?
2 weeks ago.
Okay.
Or something like that.
Okay.
But
right. Okay. All right. So any musculoskeletal problems with the way you walk?
Yeah, I have a knee injury, ACL and PCL and thing. And then I have an ankle issue on the other one, but thank God since losing weight, Andy hasn't twisted my ankle. That would be hell.
Okay, so does this affect the way you walk?
Yes, and Dr. Burness, who was my orthopedic surgeon, and there was issues of constantly being able to keep my appointments with him. Mm-hmm. He had the transportation issues in and out of hospitals and hotels last time, and, he questioned a muscle problem related to a developmental disability. Like that Willis-Parter thingy, he called it, possibly. And
what did he call it? Prader-Willi?
He called it Willis-Parter or something like that. I don't know exactly what it is. Everybody throws out. Was it
Prader-Willi?
Yeah, something like that. Don't know. Sorry. I think that's what it was called.
Oh.
But I don't know. And
okay. All right. Okay. So describe for me, because I can't see you, like what it looks like when you walk. Like, how is it varied from normal? Are you limping or?
It's limping and weak on the one side, but I don't. That's how I can only put it together. I can cover my ears. It's iron.
Okay.
But it was a delayed. I didn't walk on time. Mm-hmm. I didn't even walk. Rather, I didn't even crawl. I went from laying to running and jumping at around 2.5. My mom said.
Mm-hmm.
So there might be something with that. I don't know. With my muscle problem, I don't know. I do know that it's hard for me to grip onto things and to, with my hands and open things and tie, sneakers and stuff. But yet, I know how to tie.
Okay, so it's hard for you to do things like tie your sneakers?
Yeah, and you hold a spoon, and I miss my mouth a lot of times, or I spill it off the spoon, or, silly stuff.
Okay.
It's kind of, and it's hard for me to be able to play a guitar.
Okay. So you're telling me that you have some sensory impairments. Tell me about those.
Noise. Would that be the noise, the light?
Yes, anything.
The noise, the light, the smell, certain smells. Well, yeah, certain smells, Andy, has to smell like flower smells. Soaps, lotions, things like that. And textures bother me. But yet, certain textures I had to touch. I don't understand why. And then, very sensitive to temperature changes, pressure changes like we're going through right now. And things like that. And if things are just too much going in and out, it's just too much. I don't know if that's a sensory input or not.
Yeah. So, pressure...
Walmart bothers me a lot.
Okay. So textures are disturbing, noises are disturbing. There are some smells that are disturbing?
A lot of smells if there's too much or for too long. And lights. Everybody said LED lights are more friendly for people with sensory problems, but they're brighter.
Okay.
They may not flicker like a TV or a CFL, but they're bright.
Right. Well, everybody's different, right?
Yeah.
Okay. All right. So you're telling me you're not having a depressed mood, and you really never had a depressed mood. Is that correct?
Well, depressed, would that be like a feeling worse than sad?
Feeling, yeah.
Okay, that feeling is way rare, even more rare than feeling sad.
Okay. What is your sleep and appetite like?
Usually, it's hard for me to fall asleep when overwhelmed or sensory or upset. But once I sleep, it's very hard for me to wake up. I can't wake up to alarm. Even a thunderstorm is how loud they can be, or a fire alarm. Andy has trouble waking up to them.
Okay.
And those things can cause meltdowns. So I do sleep a lot. And the only time that Andy would wake up is when I'm wet and cold, or somebody would come, tap it on me.
Okay. All right. Do you ever have a period of time where you didn't sleep and didn't miss it?
What do you mean didn't miss it?
Okay.
You felt like
you did
I
not
need it?
You didn't sleep and you didn't feel tired.
If you want to make sense, Andy needs sleep. But that's something I need to do to prevent meltdowns.
Okay.
And,
anxiety?
What?
Anxiety. Tell me about anxiety.
What do you mean by that? Like, feeling scared?
It could be you're feeling nervous.
Yes.
Can you tell me about that?
Like right now?
Well, in general.
Yeah, like right now, Andy's like scared because I'm talking to someone new. And
Okay.
there's like a lot of cars that are allowed outside and, in my room, so it's like, that's the kind of stuff. And and wondering if Andy's going to be able to get help, is what my dad's going to do next, when I'm going to be able to get, food, am I going to be able to take my medicine safely and properly? Is Andy going to be able to, why I can't do this on my own, but able to remember everything?
Okay. Did your mind ever play tricks on you where you saw some things or heard some things that weren't there?
No.
Okay. Anybody ever, you told me about the incidences with your father. Has anything else that you feel like you've been hurt by?
Other than my dad and not getting the help Andy needs. And my mom used to be somewhat similar when younger, but she was never like my dad. And my dad never used to be like this, by the way. To me, at least. But my dad used to do the similar things to other people.
Okay. So previous things that
it's
people
why
have...
my older brother and older sister and almost the entire family has no contact with my family.
Okay. So things that people have diagnosed you with in the past. Psychiatric diagnosis, and then I'm going to ask you for developmental diagnosis.
Can you repeat what you asked me?
Yeah. Psychiatric diagnoses. You mentioned earlier bipolar disorder.
Yeah, I've been diagnosed with everything in the book. You can go from anything from like schizophrenic disorder, which you may have my ECMC records. I give it to Adam, and it's like really, you could give me something to Andy, been denied, insurance denied the Dr. Simria second assessment because ADHD and schizophrenia cannot go together. And I don't have the symptoms as schizophrenia. Whatever bipolar is, ADHD, autism is, and I don't understand those way that is written. But I know I don't see things, hear things, or things that are not there. And he understands how that became a misdiagnosis of mine. And that's where my thought process issue, which is been a lifelong problem. And that's where I will give you a question. Been told on my school record it is written as handicapped learner. Been told that term is a cognitive developmental disability. Is that, and I've been told by a friend that I used to work with on Facebook until silly me locked my Facebook account out because I forgot the password, because she wanted me on a separate Facebook account because people were just talking so mean to me and to her about me. And so she was working with me on a separate Facebook page, and she's a developmental pediatrician who helped me realize, like, what are my problems are. What?
Right. So, Andy, you've been diagnosed with what kind of learning disabilities have you been diagnosed with?
Everyone.
Okay. Like,
including math, but Annie don't understand why I had a math gift when in school. And they held me back in school on that one. Because
so you've been diagnosed with some disabilities. What have you been diagnosed with? Have you been diagnosed with autism? What?
That's where I'm so confused. Like, what is wrong with me? I mean, Andy had my confirmed diagnosis that I don't understand why it's no longer on there. Auditory processing disorder, ADHD, expressive receptive language disorder, sensory processing disorder.
Can you give that one to me again too? What was the auditory one?
Auditory processing disorder.
Okay.
ADHD, expressive receptive language disorder, ADHD, been told there is an autistic disorder diagnosis on my school record somewhere.
Mm-hmm.
And, you know, I'm trying to figure out how to say this stuff. I'm sorry. You got me off guard. And then I have, I'm sorry. I just don't know how to say it. Let me try writing it down. The auditory processing disorder was my first diagnosis with the Tourette syndrome. And, you know, which is now what Dr. Lichter feels is part of my autism, basically. And I don't understand.
Who's Dr. Lichter?
Who's Dr. Lichter?
Yeah.
He's a doctor who diagnosed me with Tourette syndrome.
Is he a neurologist?
Yes.
And he
owes me a test scheme.
Oh, okay. So, when's the next time you're going to see, and who is this, Dr. Lichter?
Yeah, he's seen me since 6 years old.
Okay.
ADHD, and then there was,
so, Dr. Lichter, I'm sorry, Andy, I just want to go back.
Okay.
So you're followed by, neurologist Dr. Lichter?
Yeah.
And where is he with Dent, or where is he with?
Brain and Spine Center. He was originally at Children's Hospital.
Okay. And you've been seeing him since you were 6. When's the last time you saw him?
Last time I saw him, January.
Okay. Last seen in January. Okay.
And then I have, you know, like I said, the expressive receptive language disorder, and then the question, the autism. But people say the sensory processing disorder, and that's where my primary said would be part of the autism. And I'm like, you know, and then I've been told the autism has a developmental delay with me. But my mental health diagnosis, I've been diagnosed anywhere from schizophrenic disorder to bipolar to PTSD to severe depressive disorder to, you know, conduct disorder to personality disorders, you know, the adjustment disorder and everything in that book pretty much.
Okay.
You might as well throw in the elimination disorders. You might as well throw in the adult baby, you know, disorder if you want to add those ones, if you wanted to. And it's not a doctor to diagnose myself, but no doctor agrees with the next doctor from the previous doctor's diagnosis.
Okay.
I have like 80 diagnoses with the confirmed developmental disabilities. I don't agree with the anxiety disorder unspecified. I think it's general anxiety disorder. Okay.
All right. So tell me about previous medications that you've been on and what was good and bad about each of them.
Well, the Abilify helped me with my feeling, like being able to react to my being scared and sensory triggers. You know, and put like a fence between me and my environment. So Annie didn't have ability to react to it.
Okay.
Had a lot of side effects with it, but it actually helped me. And one of the biggest side effects, it hurt my language ability. Since coming off of it, I've been able to express myself better in both language, verbal and written. And the steroid for ADHD helped me be able to pay attention, sit still longer, and be able to learn new words and new word combos with the AAC that speech wanted me to use. But medications like lithium, Depakote, few other that class mood stabilizer thingy, that made me aggressive, very agitated, and did not help, like the Risperdal. And the other medications that were on were like Risperdal, and a lot in that class did not help me. And the last one that was given, is Seroquel in that class?
Yes, it is.
Okay, when they gave me that with Haldol, which was more the Seroquel than Haldol, and Niagara Falls Hospital when it had Seroquel and meltdown, because they took off my weighted vest and took away all my sensory things.
Okay.
They only kept me for 3 days because apparently Seroquel with autism sometimes can cause a lot of issues. And that was a question, so they didn't have a confirmed autism diagnosis, but they gave me that medicine to try to help me relax. It should have tranquilized me. Instead, it did the opposite. It didn't even do anything for me. And they were very surprised, and that was one of the indicators that they said could be like with the heart problem. But Andy didn't have, it was a brand new hospital at the time, and I did not have the ability to express myself. It's causing me, rapid, heart beating feeling and pain. And shortness of breath. And Thorazine did a similar thing. But Thorazine puts me where makes me hearing things that's not even there. Like, how can an MRI, when ECMC knew it was an allergy of mine from a very early age. And yeah, Andy was given that in November of 2018 to whatever the first arrest was, when I had to have an MRI of my brain and spine. And they knew that was a, allergy of mine, yet that was so scary. That never did that ever happen to me.
Have you been admitted for a psychiatric hospital?
Not forever. Not in a very long time. Last time was 16.
Okay, and what happened then?
That was a court order.
Okay, for why?
Why? From when I hurt my brother in the meltdown. They call it a meltdown. I don't know what it was then. But that was when Andy was on Depakote at a very high dose and maximum dose and Risperdal at a very maximum dose. Had kidney and kidney failure and liver issue with those two.
Okay.
And they immediately took me off of them, and then they put me on, a week dose of Haldol and lithium, but that didn't help me, so they changed it to Abilify and lithium, which didn't help me. Then they took me off the lithium and tried something else, and then, but they kept me on the Abilify, but then they kept me on the Abilify.
Okay.
And that was, like, my longest medicine ever. Andy does have a question. Okay. Third person. I do have a question about possible medications. It was a medication similar to Klonopin. That treats blood pressure, but treats people with ADHD and anxiety. And then there was an antidepressant that can help for the sensory problems. Would that be possible?
So clonidine is sometimes given for to help with blood pressure, and it has an off-label use for anxiety and attention deficit disorder.
Yeah.
Is that a medication you've previously taken?
When younger, and I had issues with the side effects of the heart.
Okay.
I think. I don't know.
Right. And what antidepressants have you been treated with?
The only one that I remember was Prozac or Paxil or something like that.
Yeah, right, two different ones. But what was your response to those?
I don't think they ever really helped with my behaviors. I don't know. I was too young to know.
Okay.
But there is a medicine similar to Klonopin that starts with a V, I think, or something like that, that I've been told has a lot more help than than the Klonopin for other people that have similar issues with me, like me.
Yeah, Valium can sometimes be helpful.
It's not Valium, it's with blood pressures. Oh, Valium, forget that one. That doesn't help.
And so the medications in that class, which I would not prescribe on an ongoing basis, but
Okay.
could be helpful on an as-needed basis, the medications in that class include Klonopin, Ativan, and Valium.
Would Ativan be like hydroxyzine?
No.
Okay.
Hydroxyzine is something else.
And that did not help.
All right.
Benadryl
Right.
helps
Mm-hmm. Okay.
as a needed thing.
Mm-hmm.
But can you help me with something like that? Or is there something to help me for, like, being able to pay attention and sit still longer? And that's similar to the steroid that really helped me, that was for ADHD.
Does the Strattera help you?
Yes, a lot. It was like the only other medicine with Abilify that helped me.
All right. So we're gonna hold that thought. We're gonna get back to that. I gotta ask you some more questions.
Okay, sorry.
Okay. Oh no, that's okay. So other outpatient treatment?
What do you mean?
Like you're coming here to see us and to see Fran. Have you had other and to see Adam rather? Have you gone to other clinics like that?
Horizons.
Okay.
Last 18 years, 3 different times they discharged me.
Okay.
The first one that wasn't their fault was working with another like agency to as linking me to services that linked me with what's it called North Tonawanda thing through Buffalo Psychiatrist Center outpatient clinic thingy. But those doctors were completely not nice. I never had a doctor named Dr. Zhu, let alone how she treated me. Where my at the time was in, and it was after my case was closed with the Tonawanda court at 116, but Judge Casada, who I consider as a second dad, had, stayed on helping me, like as a mentor. He fired those people, and I went back with my mom's help back to Horizons. Never had a counselor there that really was able to help me. It was always like talk, about this, and then, anything you want to talk about. It was never helpful. Andy just needs someone to plan my, therapy and what my needs are. Not to talk about things and then give me no solutions that help me, but teach me how to practice them.
Okay. Have you ever tried to kill yourself or hurt yourself?
One time. And that was because I was very scared getting, very scared because of the warrant repeating my dad's words in the text message. At the time, I didn't even know what I was being arrested for. Or, had a warrant for November.
So, when did this happen?
Last November.
And you were arrested? What did you do?
I OD'd when I received the warrant. Because I was very scared. It was not planned. I was reacting on being so scared, like, what did I do? And confused. It was never
Wait. So you overdosed?
Yeah.
Okay.
Hydroxying. And that's where Andy's trying to teach my friend John, who's also a patient of your guys', John Lathrop, whatever his name is, not to use your communication from just to be put on 941.
Okay. So what happened in November? You're mentioning an overdose. How come? What happened there?
I was very scared because I had a warrant mailed to me for my arrest.
And what was the warrant for?
Well, found out after all this stuff, Andy was accused of poisoning my dad's stew and coffee. Never did I do those things. Just repeated my dad's words to a bunch of people, including a retired detective. If he thought it was a problem, why didn't he go to police? And why did it have to be other people who go to police, not my family? If that makes sense.
Who called the police?
Apparently, my dad was told by my friend Joanna Lucuso to go to police if it could be something concerning. Because at the time, everybody was sick, including me. And it wasn't, it was all along. It wasn't even just after that stew. So and I had a stool sample to prove what was wrong with me. But it's confusing to me, like, why did he do that when he knows I don't do stuff like that? Why did I get arrested for just repeat my dad's words on the Andy words all my life? Just wanted to be smart and not use the word that my dad used, which was X-Lax. And he wanted to use magnesium sulfate. Well, magnesium sulfate is MGSU, abbreviated. So I used that as my abbreviation to show my smarts with repeating my dad's words. It is also why my brother won't take me to movies anymore, because Andy repeats a lot of words.
So you repeated some of this stuff on social media, and somebody thought
it
you
was
were
a text message. It wasn't social media.
Oh, okay. Yeah,
Yeah, repeating my dad's words in a different way, never actually doing what was being said.
Okay.
And it was
so you sent somebody. Did you say you sent somebody a text message saying that you did this?
Yeah, and it was like 13 different people. My friend.
So you sent a text message to people telling them that you poisoned your dad?
Yeah, and my dad and mom and brother were included in the text message with all my friends.
Okay. So what was the motivation for that?
It was just repeating my dad's words, just to try to show, I don't understand why I did that. I do that all the time.
So you said
movies repeat people's words.
So you put in a text message that you poisoned him?
Yeah, I thought it was funny. Didn't even actually do it.
Okay.
There was one time Andy did, put Miralax. No, not Miralax. I don't remember what it was at the time. It was a stool softener, and my dad's coffee went at 15 or something like that. When he used to work nonstop, wanted him home for one time a day. In my life. It was, during school break, and Andy just wanted my dad to be around me. He never was around me growing up. So that's when I did that. Never did Andy do anything on that text message that was already been dropped.
Oh, okay. Gotcha. All right.
Because
any violence toward others? You mentioned that that there was a problem with your brother.
Yeah, I used to be violent unintentionally.
Okay.
Now is still my biting my arm or hurting my head. I came a long ways with that still. But that still scares me because Andy's head hurts still from that.
Yeah, okay.
Please, let's not talk about meltdowns, but they scare me and other people.
Okay.
They hurt. It's something that I can explain with the help of YouTube. It's like everything builds up. And then it's like, then I lose control. I'm not able to remember anything that's happening in it. It's like I black out. I'm not aware of what I'm doing or what other people are doing around me. It's not like when Andy's upset. I'm aware of what's going on around me.
All right, I understand that. Thank you. So,
it's like tunnel vision.
Okay. Ever have any court-mandated psychiatric treatment?
No.
Okay. Alcohol and substance use?
Well, was that court-mandated thingy, would that have been when I was 16 in CPC? That was a court-order stay.
Okay. As a child, right?
Yeah.
As a teenager? Okay. All right. So, alcohol and substance use?
I hate alcohol. That's a sensory problem. And feeling drunk really makes me feel bad.
Okay.
And I hate it. And Lortabs, please, as a doctor, don't prescribe that for me.
Yeah.
That makes communication problems worse. I refused it with my shoulder injury.
Okay.
Other than therapy.
Tobacco? Do you smoke?
Yuck.
Okay.
My mom used to blow smoke in my face, knowing that it caused me problems. Not only to breathe, but meltdowns.
Okay.
My dad used to bear hug me and tickle me. I love bear hugs, but tickle, that could be just too much when it gets, when it's too long.
Okay.
I don't like hugs unless it squeezes.
All right.
And why does my vest, I already know the science behind it. Why does my vest and teddy bear, when I give myself bear hug and weighted blanket, help?
Yeah, it's interesting. I don't know the answer to that, but it does.
produces dopamine.
Okay,
Because it
makes sense.
releases the muscles around your body to give you that feel good.
All right.
Motion. Sorry for giving my knowledge.
No, please. Thank you for sharing that, and I appreciate that. That sounds like a good thing to use. All right. So medical and surgical history. You're telling me you have diabetes. Is that correct? Okay.
And can't test my sugar because Annie's scared of hurting my own self.
All right. What was your last hemoglobin A1C?
I don't know.
Okay. What was your last blood sugar when you did check it?
I think it was like 160, but I was anxious. And it was when Annie didn't even eat for like 2 days too, which is very weird. It's weird when I'm upset and overwhelmed, my sugar rises even without food.
Okay. So when was the last time you checked it?
A few days ago when EMS helped me.
Okay.
When I was on the streets in and out of hospitals, so it was my head injury. Anytime I walk along, which my head started hurt talking, you know, anything I do that caused my head to be worse.
Okay. So when the medics checked your blood sugar, what was it?
160 something.
Okay.
And yeah, Andy didn't even eat for 2 days because I had no food, no ability. Hospitals won't even give me any.
Okay.
And how can a hospital not even give you water?
Okay.
That's not right.
Okay. So diabetes. What else is in your medical? What else is in your medical history?
I have to get that on my list. Hang on. I have a medical ID thing I carry around.
Okay.
Because I have trouble with this stuff.
Yeah, that's okay.
Let's see here. You already talked about the pee and poo problem. I don't know how to pronounce it. This is the sweat gland infection. I'll spell it for you. HIDRADENITIS.
Okay.
Anemia.
What kind of anemia?
RESRACTORAY.
Okay.
Obesity. Obesity.
Okay. How much do you weigh?
How much you weigh? 270, I think it was, or something like that. Don't remember.
Okay.
Stomach bleeding or the GI tract unknown. They think it's within my small intestines.
Mm-hmm.
Because it's, the color of poo that is, and the type of blood when they test it.
Okay.
Asthma, hypothyroidism, migraine without aura, non-respiratory, a knee injury which is still ongoing, and have a slap tear in my right shoulder.
Okay. So, what medications are you on?
Lots.
Okay, so tell me what they are.
Clindamycin topical. Supposed to be on that. Beta fiber, fiber gummy.
Okay.
Albuterol. Probiotic, which is in line. Protonics. Can give you the exact dose of that one. It's 40 milligrams one time a day.
Okay.
For that. Vitamin D3, which is 2,000 units. Colace, which is 100 milligrams twice a day. Tylenol, extra strength, 1,000 milligrams 4 times a day.
Wait. Tylenol, how much?
1,000 4 times a day.
That's too much.
Well, that's the max dose I'm told. I don't take it all the time. I only take it 1 time a day.
Okay.
Because I don't want to take it too close. It is a very dangerous drug for your liver.
Yeah.
So Andy, don't accidentally take too much. I don't take it unless I absolutely need to, or.
What do you take it daily? Daily as needed?
Daily, yeah, as needed.
Okay.
Yeah.
Okay. But you're taking maybe, how many a day do you think you're taking?
Just 2 a day, because I don't want to take too much of that too close to each other.
Right.
I don't want to get sick.
All right. What other
And
meds
that's where Andy needs help taking my medicines properly, so I don't, have pain.
What other medication?
Be worried about taking too much. DESTIN, Destin,
Okay.
That I was told to stop into the skin stores of the sweat glands of heel
Okay.
because of that could be cause the issues all along.
What else are you on? Are you on any medications for your diabetes?
I'm getting to that. Iron, 325 milligrams. Twice a day. Zofran, 4 milligrams. As needed. Every 3 times a day. I got some ears. Demesta.
What are you on?
Demesta.
Domestic?
Yeah, no spray.
Okay.
Levothyroxine, 112.
What dose? What dose?
112 micrograms.
How much?
112 micrograms.
Okay.
Here, guys, spell the name. And those sirens just hurt my ears. SUMATR.
Oh, for your migraine?
Yeah.
Okay.
SUMATRIPTIN.
Yeah.
50 milligrams as needed, 1 pill, and then you take a second pill as needed within, no more than 2 and 24 hours.
Okay.
Metformin, 500 milligrams once a day. But like I said, Annie don't have the ability to take these medicines because I don't have them with me, half of them. And then my EpiPen 2-pack. My dad's still withholding me on that. What? My allergies?
Okay. So wait a minute. I just want to go back. Do you have a head injury?
Yeah.
Tell me about that.
They say it's a brain bruise. And
when is that from?
Well, when I get arrested, I've been told when after leaving court.
When was this?
When
did this happen?
I want to say, last week sometime. End of last week, when I was arrested for using my coping skills, using my oil diffuser. I didn't understand what was going on. Didn't understand why my mom never told me to turn it off, and I didn't realize she said that when out in the kitchen. It's on a YouTube video.
Okay.
Didn't understand.
No, I'm not going to watch the YouTube video. Tell me, so you were arrested last week?
Yeah, for using my oil diffuser.
Are you living with your parents?
Yeah, when it's my coping skill. Crisis service had helped me remind me of my coping skills. After having 2 good days in a row with my dad, and he had a problem with I had a problem with going to Walmart, the sensory overload, and being with my dad for a little bit. So I ended up going through that, and I ended up having an issue with my, needing to calm down. So I had put under my wedding blanket and my teddy bear and earmuffs wasn't really enough because my dad was causing issues with me at home. So in order for me to continue calming down, I was advised to use my oil diffuser. To find out there may be an issue with the oil diffuser to begin with, because it was way stronger than what it should have been. Like it happens every so often with that oil diffuser, but it never gets that bad.
So what happened with why were you arrested for using the oil diffuser?
Because my mom called the police instead of asking me to turn it off, and she wanted to, she had trouble breathing, I guess. She may be sick with that respiratory thing that's going around, like I was last week. So that's why I got arrested. It was originally for harassment, but then Andy resisted arrest. I didn't understand why is it that you guys want me to be calm and relax, but yeah, Andy gets arrested for using my coping skills. I didn't understand it, and it's not something that should be illegal. And it was no intent to hurt or bother anyone. It was just to try to relax.
Okay, so then were you taken to the holding center?
No, overnight in the jail because Andy resisted arrest, and then they charged me an extra crime for my meltdown. And they had a bad meltdown. That scares me. But then Andy was told that a police officer dropped me on my head while in handcuffs during that meltdown. And that's where most of my brain issue came from.
So you went to ECMC after that?
No, I was just in jail overnight. They denied me EMS help.
Okay. So you were all right. So you were in the hospital a few days ago. Did you have a brain scanner?
I was in and out of multiple hospitals.
Yeah, I saw that. Okay.
The one in Lewiston, the one in, Niagara Falls, Lockport, ECMC, back to Mercy. And everyone Andy went to, they were told by the Tonton Police 2-1 NAPS, there was no option for me. They had to fight to get the hotel stay where I'm at, and yet my dad allows me being here without anything to keep my room clean with a diaper. Do
you have any of your medications on you now?
I only have Benadryl, melatonin that helps me sleep. The melatonin is a lifesaver. With my weighted blanket, that is, and my migraine medicine is Tylenol and Domesta.
All right. So how tall are you?
How tall are you? 70 inches.
How tall are you? Yeah.
70 inches.
Okay. And what do you weigh?
270, somewhere around there.
Okay. All right. So where were you born and raised?
Here.
Okay. Medication allergies?
Allergies?
Yeah.
Shellfish, fish.
Okay, what about medication?
Seroquel, Raygun, Thorazine, Topamax, Dara, ADHD, NSAIDs, Demetep, Respirol, Depakote, ProAir, B-Things, Seasonal, Tramadol, Demerol, and Vega. Now, mind me, some of the ones like the Respirol and Depakote, those may have been more, unlike the Abilify and steroid, that may be more side effects that you can't take any further, like the GI bleed issue.
Okay.
Or they're not like your throat closing like some of the other ones on there.
All right. Where were you born and raised?
Here.
Okay. So what was your childhood like?
I would say not normal.
Right. Okay.
I never had my family around me, really, except for my mom couldn't care for me because as a retired nurse, she had her back real bad, so she couldn't care for me. So she had my grandpa take care of me. My grandma ended up getting Alzheimer's, which is where Andy learned that I love to have lavender oil and things like that.
Yeah.
And my mom always had that around for my grandma. And that's where I was called Flower Boy in school and never even took it as an insult.
Oh, okay.
But I always was in and out of, like, different, like, babysitters would never be able to help me. And then this one babysitter helped me with like, understood me.
Were you in special school?
Yes.
Okay.
Language development and Head Start, the Head Start program. I remember that.
What's your education?
And then I went to the fall school at the end in the autism behavior program, and then was in modified high school there at the end.
Okay. Did you get a high school diploma?
No, Ben told I do have IEP, but don't know how to get that.
Okay. All right. Okay. So right now you're living in a hotel, and you have a referral. There's a referral in for group home housing.
No, that's what this thing is supposed to be for. Andy's been told I don't qualify for OMH by Andrew Daring. Even if I did have meet their requirement, I didn't qualify because my needs would not be met. That's why I've been told to go through OPWDD. Now, there was some confusion on ECMC's last time they actually kept me on the rehab floor after being on a medical social med. They had discharged me. They were going to link me with People Link Day program, but my understanding, they never did.
Okay.
And that's where Andy was, got confused.
Yes, it sounds like that's what you need. So tell me, if I was looking at you right now, what is your appearance like?
What do you mean?
Well, what's your grooming like? Are you clean? Are you
It's
neat?
hard for me to do that part. I don't like shaving or cutting my hair, but it's something I also hate facial hair. I
Okay.
get a haircut once a year,
Okay.
and have trouble cutting my nails, but I do it, and that hurts. Brushing my teeth, it's really hard for me. Actually, Andy found a toothbrush finally. Out of all my years of not being able to tolerate toothbrushing, I found one.
Okay. So you said it's hard to clean yourself after you go to the bathroom and so on?
Yeah.
Okay. All right. So when you talk to other people, do you make eye contact with them or do you find that hard?
That hurts my eyes, even though it's not even possible. Nothing's touching me.
Right.
But yeah, that's very hard for me.
Okay.
You want to know about rocking and stimming thing? Oh, I can't. That's something that's different than my tics. Andy can control like my arm flapping, arm tapping thing that they worked on with the behavior replacement program and jail in March last year. They worked with a developmental therapist that helped me.
You're not involved in? You're not in?
Oops. Photonics. Sourcing, beefing part. I don't like shaving or cutting my hair, but it's something I also my teeth. It's really
hard to clean yourself after you go to the bathroom. And
possible. Nothing's touching me. Different than my tics. Andy can control like my arm with a
program for someone with a developmental disability.
No, Andy never.
You've never been involved with something like People Incorporated before?
With People Incorporated.
Or, a program for someone with a developmental disability?
No, Andy never, other than school and the developmental therapy and
tell me, so I have a question about your memory, okay?
Okay.
Do you remember, what you ate for breakfast yesterday?
Nothing.
Okay. Can you spell the word world forward and backward?
World. You're asking me to spell something. Can I write it down on my phone, or do I have to spell it verbally?
Oh, that's okay. I got enough information from that. You're telling me you're unable to.
But Andy will have to spell it backwards. That's where I need to write it down. That's
okay. No, that's okay. That's okay. Tell me, if I asked you, what does people in glass houses shouldn't throw stones mean? What would you think that means?
I have no clue. I'm sorry.
Okay, that's okay. Don't be sorry. Yeah, okay. Okay.
I'm smart, but you're asking me.
I can tell that. But sometimes, even though we're smart, there's things that we can't remember, or yeah.
Like being able to take a shower properly, or how to do it properly. Yeah, I'm smart. Andy learns best in pictures and things like that.
No, I get it.
And repetition thing.
Okay.
And I'm able to remember everything, including why Abilify help where no other medications help. It's because of my serotonin level is high, and Abilify lowers that, and raises the dopamine, which is low in me. See? I'm smart.
You're very smart. Mm-hmm.
But people just underestimate me.
Yeah.
And even
I understand it. I think people don't understand you.
Well, when Dr. Martin had, I had an argument with him, not argument, but, I kept on telling him, Andy thinks everything's more routine for me. Well, what does that happen when they released me in April last year, beginning of April last year, from a bad meltdown? It just couldn't care for myself, even with having a routine set up for me with OT and stuff. And you don't understand why.
Okay.
The I Need Calm Body worksheet from Autism Educators, the only one of that kind, picture step, for helping me with meltdowns. That's the only thing that ever helped me. That I struggle with still. I mean,
right.
It's like a cat being in a paper bag. You can't see yourself out of it, but you can prevent from going into that paper bag.
Okay.
That's how I see myself with meltdowns. That's where my friend, who was a developmental pediatrician, had helped me realize that you can do things like using that AEC that speech had let me use, and write things down and communicate that way to help you prevent that, knowing that communication problems of mine not being understood or other people who taking me seriously
Okay.
seriously or expressing myself
All right.
or sensory problems cause meltdowns.
Yeah.
And
yeah.
then maybe learning that there's anxiety meltdowns too. I'm having.
Yeah. You have a lot of insight, right?
What's that?
So, self-awareness.
Well, no, I'm just telling you what other people tell me.
Okay.
If that
All
makes
right.
sense. And that's where I've been accused I'm learning on YouTube on how to be autistic and be fake. And yeah, Andy don't understand why. I'm just using those videos to try to show my family my struggles. And then when doctors tell me one thing, like I script all my language, like in speech, and that causes me to be passing, I'm going to tell you, and then you're going to be like, what's going on? Are you faking these problems? Like what the ECMC called me, like APEC. And he's not faking my lifelong problems. The
Okay.
Abilify did help me with the stimming, but it's still rocked in our
Right.
flat.
Right. So at this point, I really don't see a medication that I would prescribe for you at the present time in your present circumstance with your symptoms.
Okay.
So we could reassess this, but it appears to me that you need to be someplace stable first where someone could help you with your medications and where your symptoms are being managed for your sensory impairments.
Well, can we say this? I feel most of my anxiety is caused by not having routine and all this change. That is where I'm aware of that. I can't take any more changes. Can you help me get in the group home where Andy can get some of my needs met?
Yeah, I will talk to Heidi about that and see where the referral's at.
Ben told OPWDD is the only option for me. Had to go for a fair hearing, but government shut down with that virus.
Right, so things might be on hold for a while.
Yeah.
But I'll check with Heidi and Adam. But right now, medication-wise, I don't see a benefit to giving you a medication right now under these circumstances.
Yeah.
Does that make sense?
Yeah, and right now, Andy would not even be able to take it safely or effectively either.
Right.
Can you?
I get that.
What do you think is wrong with me diagnosed-wise, other than we all know it's the autism and developmental problems, but what about mental health?
You know, yes, I'm gathering from what you're telling me that you have some severe sensory impairments, and beyond that, I think that kind of would be confounding everything else. And we need to get into the kind of help that you need for that. Yeah. So, and that's what I'm going to share with Adam and Heidi as well.
Please
okay.
Just help me learn so Andy can help other people.
Yeah. So I'm not going to prescribe a medication for you, and that's my recommendation at this point in time. And then I will follow up with Adam and Heidi. Okay.
Yeah. So you would be to help me get into the group home and work with my providers on that?
If you get it, yes. If you get into a group home, we can reassess this conversation when that happens. But somebody ask Adam and Heidi where they're at with that referral.
Can I make a question about this? Because I've been told that community services for everyone would not take me at this point. Plus they're closed right now.
I'm sorry, I don't know because I'm not familiar with those agencies.
Well, Community Service for Everyone is an emergency shelter for people with autism, but they're closed for the virus thing that's going on. There's people like me been told by 211 and crisis services and the police because these people can't communicate when they're sick, or that kind of stuff. Which is true with me in a lot of ways. Okay. But they would also, not help me in the past when they had, that autism question on my record from very young. And how they're
I don't know, Andy. I'm gonna just share that my concern with Adam and Heidi.
Yeah, because there's not an option.
And then we'll see. There's not a medication that I would prescribe to you right now.
And there's not a shelter that will ever.
Dad, I don't know anything about that. You would have to ask 211.
Just telling you, there's not a shelter option. That's why Andy spent a week on the streets. And it was a flake.
Well, I'm glad that you're at least in a safe place right now.
Yeah, because being on the streets, Andy's risking getting hit by a car.
That's not good for you. Right.
I almost got hit by a car so many times, and there is a risk of a TBI when younger, at age 20. my only successful job at McDonald's got ruined because of my hit by a car.
Okay.
Yeah.
All right, so I'm going to have to go. I'm going to have to go now.
Okay,
but
thank you.
I will share that with Adam then. Okay.
Okay,
All right.
thank
Take
you.
care of yourself and stay in your hotel. All right.
Yes, thank you, thank
Okay.
you,
All right.
thank you.
All right. All right.